Obesity and diabetes, a study on the correlation between obesity and diabetes. Research review on the following two articles: Active life expectancy of Americans with diabetes, risk of heart disease, obesity, and inactivity, and the article Genetic Vulnerability to Diabetes and Obesity, Does Education Offset the Risk? Obesity. According to the Centers for Disease Control and Prevention, CDC, obesity is one of the most common and costly problems in the United States today. In 2008, the estimated annual cost of obesity was over $147 billion in the U.S. alone, with over 1/3 of U.S. adults being diagnosed as obese. Obesity leads to many preventable causes of death, including diabetes mellitus type 2, heart disease, stroke, and even certain types of cancer. This is according to the CDC 2014. Diabetes. According to the U.S. Department of Health and Human Services and the Healthy People 2020 objectives, diabetes is the 7th leading cause of death in the U.S. and affects over 23.6 million people. According to the U.S. Department of Health and Human Services, diabetes lowers life expectancy by up to 15 years, increases the risk of heart disease by 2 to 4 times, and is the leading cause of kidney failure, lower limb amputations, and adult onset blindness. The first article, The Active Life Expectancy of Americans with Diabetes, Risk of Heart Disease, Obesity, and Inactivity, by Laditka and Laditka, 2015. The problem statement of this article: the article uses a fairly lengthy introduction to explain the background and purpose of the study, including the problem that they are attempting to research as well as their supposed outcomes. Laditka and Laditka use the following problem statement in their article: about 26 million people in the United States have diabetes, a common cause of disability and death. Lifetime risk of having diabetes is over 33% for women, 33% for men and 39% for women. Diabetes often causes difficulty with activities of daily living, such as walking and dressing. Many people with diabetes also have heart disease or are obese or physically inactive. Each of those health factors reduces life expectancy and increases the risk of disability. Those factors may confound the association of diabetes with disability and life expectancy, yet no study has examined that association after controlling for them. This study adds to knowledge about diabetes by estimating the association of diabetes with disability and life expectancy with and without heart disease, obesity, and inactivity. This is on page 37. In short, what this study is hoping to accomplish is to show the correlation between diabetes and death of individuals because of obesity, heart disease, and inactivity. Laditka and Laditka, 2015. The article by Laditka and Laditka, 2015, uses the high prevalence of diabetes to express a major problem that needs further study and research. This article uses the measurement of active life expectancy to determine the correlation of death to diabetes. It then explains the research in the problem statement by saying that this study adds to knowledge about diabetes by estimating the association of diabetes with disability and life expectancy with and without heart disease, obesity, and inactivity. It's Laditka and Laditka, 2015, page 37. The research questions, along with rationale for the questions for this study, according to Laditka and Laditka, 2015, the following is the rationale for their research question. Heart disease, the research question is, what is the association of diabetes with disability and life expectancy with and without heart disease, obesity, and inactivity? According to Laditka and Laditka, the following is the rationale for their research question. Heart disease is one of the most prevalent diseases in the United States. Diabetes causes vascular damage that substantially increases the risk of developing heart disease and doubles the risk of dying from it. It is nonetheless useful to consider the health risk of diabetes that are independent of heart disease because people can control diabetes and reduce heart disease risk by avoiding smoking, maintaining healthy weight, eating a heart-healthy diet, controlling blood pressure and low-density lipoprotein cholesterol, and following the treatments recommended by their physicians. It's on page 38. The growing prevalence of overweight and obesity is contributing to the dramatic increase in diabetes type 2. Obesity is also linked with a greater risk of disability. Results of research associating obesity with mortality among people with diabetes are not consistent. There is evidence suggesting an obesity paradox: higher mortality with normal weight than with overweight or obesity for people with diabetes, although a recent study did not support this theory. Some studies have found greater mortality risk only with severe obesity. Other researchers have found that being physically inactive, which is common among people who are obese, increases mortality with diabetes. No related research has measured activity and obesity with adequate time before measuring disability to limit the possibility that disability caused the inactivity or obesity, rather than being the cause by them. We addressed that substantial research gap. It's page 38. The research hypotheses of this study. The first hypothesis, according to Laditka and Laditka 2015, was that the impact of diabetes on disability and life expectancy would be less than previously estimated because researchers have not controlled for those factors. Page 38. The second hypothesis of this study was that these associations would last to the end of life, resulting in a markedly smaller percentage of those with diabetes and one or more of the other health conditions having no month of disability in the last year of life, compared with those with diabetes without the other factors. Laditka and Laditka 2015, page 38. The variables, independent and dependent, of this study, as described by Keller and Kelvin 2013, independent variables are the variables that are able to be manipulated and determine the outcome of the experiment. The independent variables in the research, as described by Keller and Kelvin 2013, are the individual's health behavior and behavioral intentions. As described by Keller and Kelvin 2013, dependent variables in relation to this study are the variables that are expected to change based on the manipulation of the independent variables or based on the outcome of any interventions. The dependent variable in the research done by Laditka and Laditka 2015 is generally considered to be the age of death. The other dependent variables could also be considered the individual's diagnoses of diabetes, heart disease, and/or obesity, as these variables can change based on a change in the individual's personal health behaviors. Researchers must also have to take into account disability as measured by the ability to perform certain activities of daily living. The research design of this study, as done by Laditka and Laditka 2015, is congruent with that of an observational design study, making use of data from a case control study done by the Panel Study of Income Dynamics. That's PSID, that began with data in 1986. The population and sample for this study, according to Laditka and Laditka 2015, the sample consisted of data from the Panel Study of Income Dynamics, PSID, and consisted of a nationally representative sample, ages 55 and over, who identified themselves as African American or non-Hispanic white, from 1999 through 2011. It's page 38. The data collection methods for this study, according to Laditka and Laditka 2015, In the original case control study done by the PSID in 1986, participants were asked the following questions to measure prevalence of heart disease, diabetes, and physical inactivity. Has a doctor ever told you that you have or had diabetes or heart disease? Page 38. Do you get any regular exercise, such as doing hard physical work or walking a mile or more without stopping or playing an active sport? Also page 38. The body mass index, or BMI, of participants was also assessed using their reported height and weight, and obesity was defined as having a BMI greater than or equal to 35.0. Laditka and Laditka, 2015. Using the data gathered by the PSID and organizing the data based upon the correlation between diabetes, obesity, and heart disease, Laditka and Laditka 2015 were able to form a graph of the relationship between the different factors, disability and death, as seen in figure 1 above. Statistics and data analyses. By using a regression model, Laditka and Laditka 2015 were able to apply maximum livelihood methods to the measured interval of each disability transition to identify Markov chains in the observed data, estimating disability and death transition probabilities for each month of life, conditional on all measures in the previous month. It's page 39. Excuse me. By using Markov models, Laditka and Laditka 2015 are able to study active life expectancy of the individuals involved in the research study. According to Sonnenberg and Beck, a 1993 study, a Markov model is a graphical representation of different aspects of a statistical research problem, displaying different aspects as separate but connected entities of a whole, with connecting lines between possible causation of events. Markov models can be considered as an oversimplification of the connections between independent and dependent variables in research. Sonnenberg and Beck, 1993. The study conclusions, excuse me, based upon the information presented in the article by Laditka and Laditka 2015, there is an overwhelming relationship between diabetes, heart disease, and obesity when their prevalence were correlated to disability and death. As seen as we saw in figure 1, there was a direct correlation between these factors. With increased incidences of illnesses, there is an obvious increase in instances of disability and possibly earlier death based on the information provided. The strengths and limitations of the study. The research article, Active Life Expectancy of Americans with Diabetes, Risk of Heart Disease, Obesity, and Inactivity by Laditka and Laditka 2015 provides a fairly good example of the use of statistics to analyze data that was already available through an existing database. The data seems to be a strength of the study in that it is thorough and collected over time with multiple individuals in a seemingly wide population. The obvious flaw with this type of information gathering is the lack of factual information available about the individuals that participated in the original study done by PSID. The information was assumed to be accurate, yet was based on the recollections and information provided by the individuals, not physician or hospital-based records. According to Keller and Kelvin 2013, the case control study that the PSID data is based upon could be skewed due to the information being based on the memory of the individuals in the study. Any conclusions based on this information should be phrased as in terms of association rather than causation. Keller and Kelvin, 2013, location 379. The second study I really don't have time to go over in this lesson, but is of the article Genetic Vulnerability to Diabetes and Obesity. Does education offset the risk? By Liu et al. 2015.